I've said earlier before a wee bit about MS perhaps being a Scottish disease, and this is something that I only learnt about 6 months back, but the first person to actually see MS lesions that we know about was a bloke called Robert Carswell. He was a doctor from Glasgow. He was from an area in Glasgow called Thornley Bank. He went to Glasgow University Medical School. Then round about 1830, he was working in Paris, about 30 years before Charcot, and he was looking at the postmortems, and he drew these pictures that we see here, and that is the first pictures of MS lesions. So a Scottish person, kind of appropriately, was the first person to actually see MS. He didn't know what it was or what had happened to the people, but he was the first person to draw it. And, you know, MS is maybe a Scottish disease because Scotland and Canada are sadly the 2 countries with the highest numbers of people with MS in the world per head of population. It's much more common in the islands, Orkney more than here, but still more common here than in the mainland. In mainland Scotland, more common than England. We don't know why. It might be genetics, it might be vitamin D, it might be when you get exposed to viruses, we don't know. But roughly 1 in 600 people in Scotland have MS. 1 in 243 in the Orkneys, 1 in 309 here, 1 in 421 in Lanarkshire where I work. It's less common closer to the equator. We do see it in Spain, we do see it in India, but less than here. You don't really see it very much in China, not entirely sure why, possibly genetic. But Western Isles a bit more. There have been studies going back to the late 70s, early 80s about MS here. This was people from Aberdeen did a study on Lewis. They found about 30 people at that time with MS or probable MS. Probably an underestimate, but certainly there has been interest in researchers coming here going back 30, 40 years, you know, so it's always been identified as a problem. And I do a lot of work for the Scottish MS Register with Chrissy Waters. Is Chrissy in the room? She's somewhere about. And this is basically a Scottish Government initiative that has been set up to try and count how many people develop MS every year. And you can see the Western Isles, according to this mechanism for counting, suggests that it's one of the lower incidence places. However, I suspect that is wrong. I suspect we're not managing to catch everybody, and there are a bunch of factors why that might be. Probably because your young people go to uni elsewhere and probably develop MS whilst at uni, and then are recorded perhaps as being in Edinburgh or Aberdeen or Dundee or Glasgow. So that's maybe skewing the figures a wee bit there. And there'll be other issues. I've discussed some with this table, but we won't go into that. Okay. Is it a modern disease? I don't think it is. Gavin yesterday thinks it is for some reason. I'm not so sure. I suspect that 200 years ago, 300 years ago, when our ancestors were crofters or that, you know, if they were up a hillside looking for a sheep and the leg went funny for a couple of weeks, they would just get on with it when it got better. You know, I'm sure you've all heard about old Mrs. So-and-so took to her bed at 30 and just stayed there. You know, I think certainly in the Highland communities that I was familiar with as a kid, that's a story you would hear. That might have been MS, it might have been stroke, it might have been depression, but, you know, I think there are signals there, you know, and the people in Scotland were perhaps not as well documented as elsewhere in the world. And it's still difficult to diagnose even now, and it's difficult to get a diagnosis. I mean, a few people have been telling me about their journeys to a diagnosis over lunch, and it can be challenging. There are barriers and things can be missed. Bladder problems, sexual dysfunction, Bell's palsy, labyrinthitis, all these things can cover up MS and be early signs that your GP might not recognise. actually seeing a neurologist is a barrier. I mean, we discussed how hard it is to even see a neurologist, getting an MRI scan, getting the specialist tests. So it's difficult and it can take years. The population of Scotland is widely distributed across our landmass. We've got a big landmass, you know, but a small population as part of the United Kingdom. I mean, our country of Scotland is only 10% of the United Kingdom. There's about 27,000 people on the Outer Hebrides, and overall across all the islands we've got about 100,000 people. So you're a small proportion of a fairly insignificant Great Britain, which isn't as important as we like to think we are in the world. Anyway, no comment. And the other thing is neurologists tend to cluster. And looking at that map, you can see that we're all backing away from the Western Islands for some reason. And, you know, it seems like quite a nice place, so I don't know what we're doing. And MRI scanners are expensive to maintain, you know, expensive to even run. The running costs of an MRI scanner on a yearly basis are ridiculous, and you wouldn't realise it. So if you guys want an MRI scan, you've got one hell of a journey to go through, you know, and some of our patients are needing an MRI scan every 3 months if they've got specific risks associated with their treatment. So actually to get a diagnosis, you'll all go to Glasgow to get a diagnosis. Then once you're diagnosed, it might be that you're listed as being in the Western Isles. Somebody might fill in the form wrong, you might get listed somewhere else, or you might be away working elsewhere, perhaps registered with a GP near your temporary accommodation or near your university. So that may well be skewing the figures. And Glasgow does tend to absorb everything around it. So the Scottish MS Register started in 2010. In that time, there's been a bit more than 3,000 people diagnosed. It is used to review how many MS nurses are making the targets of supporting the patients, and also ultimately it has helped to plan funding for the future. It helps us know what resources we're going to need 10, 20 years down the line. The star means that there have been people diagnosed but less than 5. Because of data protection, they're not allowed to say when people are diagnosed if the place is small enough, because if a postcode is small enough, because that means that you could probably work it out, you know. So there have been people diagnosed with MS every year since 2010. None were registered in 2014, but you could be waiting for a year to get your diagnosis, you know. So there are pros and cons to things. This is just comparative caseloads. Now, Glasgow's the most, Lothian's the second biggest. The Western Isles is at the end, that's 87 at that point, which was how many people Rachel had at that point, but Rachel has a massive geographical area to get around as well. So it's just to monitor what's going on. But more importantly, what services exist? I think Rachel's done something quite good. She's been speaking to somebody at Raigmore, and I understand that there's a rehab doctor coming to Leyland next week that Rachel has organised. You can access physiotherapy and occupational therapy locally. They might not be MS trained, but certainly there are ways that they can become MS trained. There are specialist MS physiotherapists at the Queen Elizabeth University Hospital, but again, you have the geographic barriers and the time taken to get there. I guess that could perhaps partly be done by telemedicine. There is the inpatient PDRU unit for rehab at the Southern General site. At one point there were 5 consultants there, there's now 1, and a lot of the inpatient services that were there before have been stripped away. Some of you may have spent time there. It is a good unit, but it is exceptionally limited, especially when you think it covers approximately 2.4 million people. And there is a regional shortage of neurodisability doctors. Research-wise, now, everybody should get the right to access research, and Again, the geographical issues probably prevent some participation. Some drug trials will exclude people that have to travel big distances because the drug trials will not always fund that. When I was a stroke researcher, we couldn't recruit people from Leylands because the drug company wouldn't pay for the patients to come to Glasgow. There are drug trials running in Glasgow, Edinburgh and Dundee. Hopefully some people here may be able to get into some. There are basic science studies in Edinburgh and Glasgow. Future MS, I know some people are in it, and it is a Scotland-wide initiative. Then there's the registers for Scotland and the UK and rehabilitation studies. Third sector support, the MS Society, MS Trust, Revive MS in Glasgow. They do some outreach stuff, but I don't know if it gets here. Vary Coots works for them. The MS Brain Health Initiative is good. And Shift MS if you like Facebook and want to have a Facebook for people with MS. That's quite good. And finally, financial support. It's a problem that always comes up in my clinic and often not much I can do, but with Citizens Advice Bureau, Money Matters, the MS Society and MS Revive can all help when your PIP claim is rejected because of austerity. Okay? Because that is a big issue and I know it affects everybody, and we're not necessarily the smartest people to help with that, but there are resources out there that can give you advice if you want to fight anything like that.